Okay. Good afternoon, everybody. It is 1 o'clock. So we have a lot of information to share today. So want to go ahead and get started. I know we still have people joining. So first want to welcome everybody and thank you all for attending to discuss this topic with us. Also want to shout out and thank the DD Council for hosting and helping us get this set up so we could reach as many people as possible. The topic that we have on our agenda for this quarterly meeting is really focused and centered on documentation. We often receive a lot of questions, and both from individuals accessing self-directed services and our providers, that we wanted to sort of pause, take an opportunity, and really explain to everybody what is required related to documentation. What we're going to share today has always been the expectation, has always been part of the requirements for our services. When we are receiving or accessing federal and state funds, CMS requires that we're able to provide proof that those services were delivered, and what we're billing aligns with sort of the dollars that are being spent. And the documentation of the supports provided, it's how we do that. So especially now, there's been lots of conversation and discussion where people are looking at fraud, abuse, neglect, waste. So we want to make sure that everybody is on the same page in terms of the expectations. We want to be able to give you all the information. And then we will not have opportunity today to take live questions, but we're asking you to put those in the Q&A for us. We're going to take all of those back and we'll put together an FAQ and get that out to the group so that we can answer the questions we received today. With that, Kim, I am going to turn it over. This is being recorded. It will be made available so that you all will be able to reference it. Or if there are other people that didn't get the opportunity to attend today, you can help us get the information out and share that with them. So again, appreciate you taking the time with us. There's a lot of information. And with that, I'm going to turn it over to Kim Kennedy to walk us through this information. Thanks, Kim.
Thank you, Christy. Good afternoon. I'm just doing a sound check. Christy, can you hear me okay?
I can hear you.
Thank you. Good afternoon, everybody. My name is Kim Kennedy, and I work in the Office for Citizens with Developmental Disabilities. Typically, my role is working with home and community-based providers. And we recently rolled out this documentation for providers. So I was asked to also provide the training to you all on documentation requirements. This training is for self-direction for individuals in the Children's Choice, the New Opportunities Waiver, and the Residential Options Waiver. We always like to start with reminding employers what our waivers are for. We want individuals with developmental disabilities to be able to have a life like you and I have as much as possible. So we want them to be able to live in the setting of their choosing and have meaningful relationships with their families and other individuals in the community. We want them to be a part of their community, have the opportunity to work and to participate in activities that you and I would like to participate in. The OCDD vision is to support a society that promotes partnerships and relationships, which empower people with developmental disabilities to live fully integrated and valued lives. So we always want to keep that at the front when we talk about services for individuals. The objectives of this training are to ensure that you understand the documentation requirements. We really have not put any information out there, so we feel like it's time to do that now. We'll talk a little bit about why. But this is to really help you understand the documentation requirements. And I don't want you to get nervous about documentation requirements. It is not going to be that difficult, but we have to make sure that the documentation truly reflects the services that are being delivered. We're going to review the OCDD service log progress note for OCDD waiver in-home services, which will serve as a template for your documentation. Now, you can use the OCDD forms. They're out there for anybody to use, but in self-direction, we will allow you to use those forms as a template, and I'll show you kind of what I mean by that in a few minutes. I'm going to provide a description of desired document content, what we really want to see when you're documenting services. And we've developed 2 notes. This was really for providers. It may be applicable to some of the individuals in self-direction, but we have a single date service note for one worker. And then we have individuals that have multiple workers in their home every day because they receive 24-hour supports. So we did a multi-shift note as well to help the documentation requirements not be too overwhelming. We're going to look at those in a few minutes. So what did we do? We sent out a memo on February 28th, 2025, telling you about this training, telling you about the need to have documentation for services that are delivered. What we're going to describe now, Christy said you've always been supposed to have notes and to have notes that document, the activities that are done each day to reflect what the day looks like when you provide services to someone. But with what we've done now, we've provided specific content that we want to make sure you consider or you include when you write your notes. So that content, we want you to start making sure all of that content is in your notes starting May 1st. We want you to continue to document and then figure out how to get the additional content, if you're not putting it in there now, how to put that additional content in your notes by May 1st. The standard forms that we have are located on our webpage at the web link seen here. And remember, we're going to post this PowerPoint. You're going to get a notice as to where it's posted. I'm also going to tell you where it's going to be posted at the end of this training. So you don't have to try to write down that long link. I've got a shorter link for you at the end of the training where we're going to actually put this PowerPoint. I just need you to give me 2 days to get it loaded. All of the forms on that page begin with OCDD progress notes. And as we go through this, I just wanted to make sure that you can send questions to OCDD-HCBS@la.gov. That's our standard email for anyone that has questions for OCDD. It's always a really good idea to put in the subject self-direction documentation if that's what your question is related to, so it gets to the right person. So what services are we talking about? Well, it's the services in the Children's Choice, in the row, and the now. It's the Family Support Service, the Community Living Support Services, and the Individual and Family Support Services. This includes day services and night services in the new opportunity waivers and shared services in all 3 waivers. So those are the services that need to be documented based on this training. Before we get into the documents, though, I want to talk a little bit about the requirements, why we're doing this. So the Centers for Medicare and Medicaid require services to be documented. Now, CMS is, they fund, in our waiver services, they pay for more than 60% of the cost of waiver services. The federal government does, CMS does. And they require that documentation exists for services that are delivered. No documentation means no services were delivered. There is nothing that can validate the money that was paid, the services that were billed. So you have to have documentation to prove services were delivered. That's the only way to be able to validate the services that were delivered. Recently, well, actually, over the past years, the Louisiana Legislative Auditor, our Louisiana Department of Health Program Integrity, and the Periodic Error Rate Measurement Audits, which is CMS, have continually found us to be out of compliance with documentation requirements. So they'll contact our providers, or some of you have been contacted by our firm, CMS auditor, and asked to provide documentation. And we had compliance issues with that documentation every single year. As a matter of fact, the LLA has issued a finding 23 out of 24 years regarding inadequate documentation. So as a result of that, we had to develop a corrective action plan and put it in place to ensure that we had oversight, to make sure documentation was being prepared and that it was adequate, and that we would have to monitor to make sure it continued moving forward. So the things that they found were no note at all for services that were paid, or you have notes for one shift, but not notes for another shift. Partial shifts were not documented. Overnight shifts, overnight shifts seems to be a big issue where they couldn't tell what day the shift started on, what day it ended on, because they documented an overnight shift. We have a little fix for that for you, so we'll talk about that in a few minutes. And are the notes adequate to support the time bill? Because remember that we are paying for these services, the federal government's paying for it, and the state is paying for it. And they want to make sure that the services are documented to support what they're paying. What we did as OCDD is we said, okay, we've always had these documentation requirements in our program manuals. What we're going to do now is we're going to go ahead and issue a standard form so people know what we're looking for in the documentation. Sometimes we've seen things where people are just checking off the checklist of, different things that they did with no descriptor of the type of service or what the service looked like, just a check mark on bathing or a check mark on any other type of service, and without really giving an explanation as to what was done. So we developed this template to use for documentation. Now, as Christy said, our program manuals have always required that we have documents or we have documentation for services. And what it requires is that the documentation should reflect a description of the activities, any procedures, any incidents that occurred during the day, give a picture of the service provided to the individual, show progress towards their goals, record any change in their condition or behavior or anything that is noteworthy, and reflect each entry in the service log or timesheet. And also, services have to be clearly related to the plan of care. You all should have a copy of your plan of care in your home. If your support coordinator has not provided you with a copy of your current plan of care, including the attachments, what we call the provider attachments, then I need you to reach out to your support coordinator and tell her or him that you need a copy of your plan of care for your home, because that plan of care tells you the goals and what is supposed to be delivered, what services are needed to support this individual. So make sure you have that plan of care in your home as well. So just a little bit about service logs versus progress notes. We talk about both in our program manuals. We say you have to have service logs and progress notes, and that gets really confusing because some people say, well, what's the service log and what's the progress note? So we've sort of split it out. The service log is more kind of like your timesheet in a sense. Chronological listing of contacts and services, what services were provided to an individual. And it reflects if it's day services, shared services, tells you who, when, where, and what was delivered to whom, and it identifies, sometimes it'll identify the personal outcomes and other issues addressed. But your progress note really pulls out the details. It gives you a better description of what the activities look like. It gives you a picture of the service provided, so you can kind of see how a day went. We want you to make sure you identify any progress towards those goals that are in the plan of care. Any changes in their medical condition, their behavioral situation, their home condition, anything that's changed that's relevant to that individual, that's important, needs to be documented in the notes. And again, it has to reflect each entry in that service log, which is more like the timesheet. And here's, I'm saying the same thing a different way. Service logs identify who, when, where, and what service were delivered, and it's required for every shift work. And we'll talk about what a shift is. Progress notes provide, like it says here, a description of activities, the procedures, the incidents, the personal outcomes that were addressed. There any changes in an individual's behavior, medical condition, or home situation, and it aligns, it supports the service log, it aligns with the service log. We've always said in our manuals that checklists alone are not adequate, that you have to have both service log and progress note elements to have adequate documentation. Okay. And we're going to do one more section, and then I'll just check to see if I need to, am I needing to show any slides or anything? Everything's good. Okay. All right. So I want to talk a little bit about the expectations for you guys as employers. And these are the same expectations we have for provider agencies, you know, the person that's in charge of the service being delivered. And it could be the individual that's receiving the service. They may very well direct their own service, and that is great. I think it's awesome when individuals have the opportunity to do that, but it has to meet the same requirements. So what are those expectations? Make sure documentation is prepared for every shift and it's adequate and complete. We'll talk about what a good note looks like in a few minutes. Do not use your DCI system to document your notes. That record is not saved. So DCI is not an adequate way to document your services. Both Acumen and Morning Sun have stated those notes go away, and you have to keep these notes for 6 years. That's the retention period defined by CMS. So we have to have access to those records for 6 years after the service was delivered. So do not use DCI. You need to have another way to document your notes, either by using the standard form or coming up with your own form that contains all the elements that we'll talk about in a minute. Do not approve time for a worker if they did not fill out their documentation or if it's missing or incomplete. This is a way for you to make sure your worker is documenting what they did. So don't approve any time if you're missing your documentation. Ask them to fill out that documentation. You know, the documentation should be completed at the end of every shift before the worker leaves the home. It's not anything that should be done at the end of the week or several days later, because you forget some of the activities that may have occurred. So documentation of the shift should occur before the person leaves the home for that shift. Again, I've already said this, you need to keep your documentation for 6 years or longer as required by CMS. And the other thing is you need to provide ongoing training and coaching to direct service professionals, your DSPs, your DSWs. You need to provide coaching and training to them if they're not documenting appropriately. How will you know if you need to do that? Well, you got to review that documentation and make sure it's good. So in order to know if documentation was written or if it's adequate, then you as an employer need to be looking at the documentation to make sure it meets the expectations of this training. Additionally, as an employer, you may be requested to provide the documentation to any of these agencies: Louisiana Department of Health, CMS, which we've talked about earlier, that's the federal government, legislative auditor, our LGEs, our local governing entities, that's like your districts and authorities. That's the agency that actually approves a plan of care. Your support coordination agencies may need that documentation, and any subcontractor to any of those agencies. So that documentation has to be made available and can be requested at any time. And it needs to be, that's why you have to make sure you have it readily available, should it be requested. Okay, I've had a request to go back over service logs and progress notes. This slide. So, and I know some of it seems repetitive on the service log side and the progress note side. I apologize for that. That's kind of how we have it in our program manual. So I didn't want to say something other than what was in our program manual. But I'm going to go to the next slide because that's a better picture. Your service log is really who, when, where, and what services were delivered to a person. So who is the DSW? When did they deliver it? Date and time. Where did they deliver it? Were they at home? Were they out in the community? And what services? Was it day services? Was it night services? Was it shared services? What type of service did they deliver to the beneficiary? And it's required for every shift work. So that's sort of, your service log is more like your timesheet, where we can pull a report and say, well, these are all the services that were provided to this person, for this week. Your progress notes tell what truly happened within that service time. So whatever time is on the service log, what happened? That's where your progress note comes in. So your progress note really gives you a picture of the activities, the procedures, the incidents, things like that, anything that's changed. It's your narrative. So your progress note is your narrative about the who, when, where, and what was delivered. So that's the difference. Don't worry about that, because what we did is we combined everything into one document. So there is only one document now. There's not a service log and a progress note. It is a combined document. So if you have all of the elements we're going to talk about in your notes, you're going to have both the service log and the progress note. So let me go. I am going to briefly talk about the difference between the single shift and the multiple shift progress note. And then after that, we're going to go into some examples. I just want you to understand what the differences are. And like I said, I did this more for provider agencies, but I wanted you all to have the information as well. So first, let's talk about a shift. What's a shift? So a shift is a continuous period of time from clock in to clock out. That is a shift. Worker comes in, they clock in, they work, they clock out, they leave. That's the shift. A split shift is when a worker clocks in, like 8 to 2, they leave, and then they come back and work 4 to 9. That's a split shift. That's 2 shifts. And you have to have documentation for each shift. So you have to have documentation for the first shift and documentation for the second shift. If you're providing shared supports, so if your if you have 2 individuals that receive services at the same time from one worker, that's shared supports. You have to have a separate note, one for each person being supported. So you can't have a combined note. You have to have separate notes. That has more to do with confidentiality reasons. When we pull someone's file, We should be pulling only that person's information, not information about the person that they shared services with. And then if you're providing two-on-one support, now this very, very rarely happens in self-direction. We have people that come out of hospital and temporarily they'll need additional help with bathing because one person can't do that task by themselves with the individual. Sometimes there will be two-on-one support. When that happens, each worker has to write their own note. So if you have one person, one beneficiary, and he has two workers at the same time, because one worker cannot do the bathing or some task like that. So he has approval for two-on-one supports. Each worker has to write their own note, no combined note for the workers. So you cannot have combined notes for shared beneficiaries, and you cannot have a combined note for two workers. I do want to talk about something that happened recently, and that's the snowstorm. Sometimes people will go into a home and they will not be able to leave because they're going to have to stay and support that individual. They're the only person in the home. Well, we don't want one, and we talked about a shift being a continuous period of time from clock in to clock out. Typically, that's within a single day. If someone had to work a couple of days because they could not leave and they had to continue to provide supports, then we would want a note for each day. You don't want a note for multiple days. You want a note for each day of the activities that happened. And they should clock in and clock out each day as well. There are questions on that? I've got someone helping me if I'm not explaining something well enough.
Questions? They all seem to be going back to progress note.
Okay.
And then also clarification on acronyms, time log. Is that a service log? Or is it one document that we basically need to be able to provide? And then still the question of to upload the documentation to BCI.
Okay.
Still questions around
Yeah. Okay, so and so this is what I'm going to do. We're not going to take those questions here. We will clarify those questions through our Q&A process because we really do want to get through the slides, and we will post the Q&A as well. It may take me a couple of days to get all that pulled together, but we'll try to consolidate the questions and get that information out to you. We developed what we called a single shift note, and I kind of alluded to that earlier, and a multiple shift note. The single shift is for one worker, one day, one beneficiary. So that's your single shift note. The multiple shift note is for a beneficiary that has more than one worker. So you have John, who is receiving services, and Ted, Mark, and Terry are assisting him that day at 3 different times. So you have one beneficiary, 3 workers in the same day on Tuesday. So you have a multiple shift note and a single shift note. We did that just to make it a little bit easier for our providers. And so these are also available for you to use if it makes sense for your individual. These are just, I'm not going to go through this because it just compares the 2 notes. And this is something that you can look at a little later if you decide to use our forms. Note the progress notes, which is the service log progress note that we prepared, are fillable or non-fillable. So what this allows is for someone to put the agency name, phone number, and beneficiary name, fillable on the form and then print it out, so you don't have to put it in every day. In this case, the agency is you. You're the employer. It allows the fillable form would allow the direct support professional to actually fill it in on their tablet, then print it out and sign it. So it can be filled out online, but it has to be printed and signed. The non-fillable form, you just print it out and fill it in. On the non-fillable form, we do have some fields that can be typed in so that you don't have to repeat that information each time, such as the employer name, employer phone number, and beneficiary name. You could even put the employee name. So there are some things that could be filled in on the non-fillable progress note so that you don't have to write it each time if you use OCDD forms. One other thing I want to talk about before we get too far is EVV, electronic visit verification. So when I talk about EVV, staff is the direct support professional who directly provides the services to the beneficiary. So when I say staff, I'm talking about the work. EVV means that the staff clocks in and out using an electronic method. In self-direction, you have 3 methods. You have the DCI app, where the DSW, when they get to the home, they log into their app and they clock in. And then when they end their shift, they log into the app and clock out. That's the app. That's not the data entry. That's actually clocking in and out on the app. That is EVV. The fob, which is a method of someone, it's a stationary device where they can click a button and get a code. That the fob is also EVV. Or if they use the landline where they call in and report that they're at work and then call when they leave. So those are your 3 EVV methods. And only the staff can clock in and out for themselves. There's no exceptions to that. Only the staff can clock in and out for themselves. The manual entry, which means someone goes in and logs in the time for someone, and then the employer, you typically go behind them and approve it, or the employer enters it, and then the worker goes behind and says, yes, I worked this. That is not EVV. That is considered manual entry. Individuals in self-direction, employers, you're supposed to make your workers use EVV. Yes, there are times when they can't use EVV. We understand that. But the requirement is that you ask your staff to use EVV when they clock in and out. So we're going to move on from that because I don't want to get into that discussion today. So manual entry is not considered EVV except for when you enter that fob information. You can enter the fob information. That's still considered EVV, but just entering time in and time out is not EVV. If the EVV entry is modified after the fact, so you have a staff that clock in, and then you as an employer go behind them and change that entry to some other time, you have to have documentation as to why you changed the entry. Because remember, EVV is their signature that this is when I clocked in and this is when I clocked out. So if you're changing that, there has to be documentation as to why. EVV versus manual. I tell you what, we'll go over this a little bit more in a minute because I don't want to get y'all confused. I feel like I'm confusing you a little bit. I'm not confused, but y'all aren't providers, so this is a little different for y'all. But I'll talk a little bit more about when you can put EVV on your progress note. If you don't write the time in, you can use EVV. We'll talk about that in a second. Let's go to this. What I want to show you is a template for a good handwritten note. So these are the required elements for the handwritten notes. You have to have your employer name and number. the beneficiary's name, the DSW's name and signature, time in and time out, home or other, that's where the service was delivered if you didn't use EVV, relationship support and community connections, education, work, social activities, health and medical appointments, challenges, ADLs, IADLs, and progress notes. Now, if you look at this, we have tried to provide a template that will kind of take you through what type of information should be documented. We want to know if people are out in the community doing activities, or if they're engaged in relationships with their family or friends, things that you and I do. If they have education, work, or social activities, we want to know what those things are that occurred while your worker was on shift. Did they have any health and medical appointments? And you won't have stuff in these sections every day, and that's okay. But we want your direct service worker to think about these elements when they write their notes, so that if anything happened that goes in these sections, that they're going to record what happened. Challenges, we talked about a change in home situation. Things happen where people have to go to an emergency room. There may be a behavior incident. There could be any type of challenge that an individual experiences in a day. We want challenges documented when they occur while the direct service worker's on shift. Your activities of daily living and independent activities of daily living, those are your, or instrumental activities of daily living. Those are your eating, bathing, grooming, toileting, those types of things. Those are your ADLs, and then progress notes. What did you do to help the person move or work on their goals, or what happened that day that showed there's progress with more independence? Okay, so here is I'm gonna see if I can make this larger. Well, can you see it okay, Rosemary?
It's small.
Okay, well, this is a handwritten note. So this is a note that you might write in a notebook, because I know some of you may feel like you cannot afford to print out forms for people to fill out. Okay, well, fine. Here's a way that you can write this information in a notebook. So I've kind of highlighted what the required elements are. So you have to have the employer and their phone number, the beneficiary name, who's the direct support worker, when did they work, what time did they work, did they work at home or another place? And then these are the main sections that you need to write information in. Relationship support and community connection. So for this example, Nancy went to visit her sister Sarah in the morning. They were making plans for a family reunion in April. She's really excited about the family reunion and enjoyed the visit. There's something that kind of describes the visit. Education, work, and social activities could be something like, I took Nancy to NTCC to enroll in GED classes. That's probably a goal for Nancy. She helped her fill out the application. The classes are Tuesdays and Thursdays from 3 to 5. It gives you good information about that activity. It's not a lot, but it describes that activity. There were no health and medical appointments that day. There were no challenges that day, but yet those elements are written on the note. So we know that there was nothing that needed to go in those sections. ADLs and IEDLs, these are the things that I did to help Nancy that day. We helped her pick out her clothes and prompted her to brush her hair. And she supervised Nancy as she made her own breakfast of eggs and toast. And the reason that's important is if Nancy did it independently, be a little descriptive of what kind of meal she prepared. The remaining daily activities were completed independently by Nancy. So she didn't need help with toileting. She didn't need help with bathing. She didn't need help with the other ADLs and IADLs, and that's fine. The progress note here is that Nancy has a goal to learn to cook small meals and to get her GED. Both of these goals were worked on today. Now look, I get it. You're not going to work on goals every single day. I understand that. But if you do, you need to capture that in the progress notes section. I'm going to stop this share and I'm going to show you another good note. Okay, here's another good note example. Let's see. Are you seeing my good note example, Rosemary? Okay, it's not on the PowerPoint. This is for Kim Kennedy.
Yes.
Okay.
Yes, Bruce.
All right, just making sure you're seeing the right ones. All right, y'all, let me move that camera a little bit. So here's another one, and I put a few more things in here. So the employer is Kim Kennedy. Employer phone number is this. Beneficiary is Mary Kennedy. The staff is Amanda Jones. The day, start time and stop time. And where's the place of service? In this case, I wasn't at home. I was out in the community. So it's other. This is one where Mary went to the store to shop for shoes. I took her to Walmart and the shoe station. Where'd we go? How many pairs of shoes did she buy? She bought 2 pairs of shoes and handed the money to the clerk. I assisted with counting out the money. So it just kind of shows what happened with that activity. Education, work, social activities, none. But she did have a medical appointment that day. She went to the doctor. Why? To talk about being tired, had blood drawn, and she had low iron. He prescribed a multivitamin with 20 milligrams of iron, went to Walgreens to get the vitamins. I told Kim, who is the employer, about the multivitamin so it could be added to the medication list, and the return appointment scheduled for 5/1/25 at 2 p.m. Now, you're not going to have things like this every day, but on the days that you do, this is the type of detail, and you don't have to use as many words as I use, but when you talk about a multivitamin, what's special about the multivitamin? Well, this one had to have 20 milligrams of iron. You know, when is the return appointment? So that type of information would be good in these notes. Challenges. Well, this worker said Mary was very scared when they drew blood and at first refused to allow it. I talked with her to help keep her calm, and after a few minutes, she let the nurse draw the blood. So that just gives you an idea that there was a challenge that day, and this is how it was handled. ADLs and IADLs, I think, are just a little bit better. ADLs and IADLs are just, you know, the things you help Mary with. So I assisted her with getting ready, prompted her to brush her hair, brush her teeth, hair, and to wash her face. Assisted with picking out clothes. Mary's moms administered her morning meds. Mary fixed her own breakfast, and we ate at Chick-fil-A for lunch. Mary selected her own meal and gave the clerk the correct change with my help. Now, if there are no other ADLs, IADLs that you have to assist with on that day, then you don't really have to write it in this. But if Mary requires assistance, and if the DSW or someone else assisted her while the DSW was on shift, that should be written in the ADLs, IADLs, because it gives a picture of the support provided to me. And then the progress note here at the bottom. She was feeling tired when I arrived. Of course, that's why they're going to the doctor, but she was in a good mood because she was going shoe shopping. She's learning to pay for items and get the correct change. She fixed her own breakfast, and we will start working on small meals for her to fix. Returned home about 4:30 p.m. and Mary talked with her friends on the phone. So that really gives you a picture of the day. She went shoe shopping, she went to the doctor, got a little bit of a challenge. The DSW helped her get ready for the day, and Mary did some things on her own. And then just at the end, just sort of what the day looked like. Hopefully I can do this without having too much trouble. I want to resume. Apologies. It's doing the right one. Yes, ma'am. Do I need to switch it?
No, that's it.
Okay. And so let's look at for the same activities that's not written well. So this would be a poor example.
I'm sorry.
Right now. Second, I apologize, guys. Correct? So you have the poor note example?
Yes.
Okay. All right. Sorry about that, guys. I won't cut back out again. This would be a poor note example for the same thing. So, I have the employer, the phone number, the beneficiary name, the worker that worked, the date and time, relationship support and community connections. Nancy visited with her sister. Well, that doesn't give you a whole lot of detail. We want a little more depth than that. Education, work, social activities. Took Nancy to apply for GED classes. Well, where'd she go? When are the classes scheduled? Things like that. And the progress notes, Nancy had a good day. That is not enough information for a shift where someone worked from 10 to 4. You need to have a little more depth in the information that you provide. There was nothing, we don't know what ADLs, IADLs they helped with, or because they didn't address it. We don't know if there were any challenges that day. We don't know if there were any medical or health appointments. So when we say your elements, if you're going to put it in a notebook, you have to have those elements in your notebook to say, no, there were no medical appointments today. There were no challenges today. So we know that that was addressed in the note. Now, what I'm going to do now is actually go through our forms. So I've kind of given you an idea of what a note looks like if you just write it out in a notebook. That's what we were looking at. I'm going to show you now what it looks like if you use our notes. And I'm not going to spend a lot of time because it's pretty much the same thing. The basic identifying information is all of this: agency or employer name and phone number, beneficiary name, date of service, which is the date the shift begins, identify if it's an overnight shift, And if yes, add the date shift ends, staff providing service, printed name and signature, start time of service unless EBV, end time of service unless EBV, location of service unless EBV. So when I'm talking about this, so this is why I wanted to talk a little bit about EBV first. On these forms, if a worker clocks in and clocks out using EBV, they can write EBV in their start time and stop time, but it has to be true EBV. It has to be that clock in and clock out. It's not that data entry. It has to be that DCI app, the fob, or the landline. Those are the three EBV methods. And so if they use that clock in or to clock out, they can write EBV in that start time or stop time. And location of service is captured if you use EBV. So you don't have to give location of service if you use EBV. So let's look at, whoops. Here we go. So this is the form. This is the top part of the form. Agency would be the employer phone number, the individual's name, date of service. For the single shift, which is this top one, they can work an overnight shift. If it's an overnight shift, just check yes, and then put both dates of service, the date the service started and the date the service ended. So if I'm going to work with someone from today, from 10 p.m. to 6 a.m. tomorrow, my date of service would be 3/12/25 and 3/13/25. And I would say, yes, it's an overnight shift. And then my time in could be 10 p.m. today, and it would be timeout would be 6 a.m. because I have both dates of service listed. You cannot do that on the multiple shift note. And so this bottom one is the information for the multiple shift. You have someone using a multiple shift note. If you have more than one worker in the home, the first person can print their name and signature and initials, time in and time out. The second person would do the same, and the third person would do the same. Or if you have a worker that works a split shift, they can put their first shift here in the shift 1 line, and then put their second shift in the shift 2 line. So that's your basic information of who, what, when, where. Let's look at the relationship support and building community connections. This section of the progress notes, it's going to identify if there is a family visit, call, or event, or a friend call, visit, or event, or an event such as a community event, community organization event. It kind of guides you into what may have happened during a relation, or how relationship support and community connection supports were delivered. How did they participate? Independently or with a family friend? Did they need any assistance from staff? And you document the specifics of these activities in the progress notes section of the note. Let me do this. I am going to stop one more time because I want to pull up that single shift note real quick so you can see what it looks like. Because I've not shown you that note, I do apologize. Let me pull that note up. Put up real quick and show it to you. So you can kind of see what it looks like as I go through the sections. Okay. Can you see the progress note? Rosemary, you see the progress note? Thank you. So this is what it looks like. Your information up here at the top is your basic information. And then we have different sections. We have relationship support, building and community connections. You can check off any of these boxes that apply. Education work, social roles, you can check off these boxes, appointments and challenges. But when I say you're going to write the notes in the progress notes section, it's going to be down here at the bottom. So as I go through each one of these, the details of what happened here are going to go in this bottom portion. So that's what I wanted you to see, where you would put the progress note information or the details of any of these activities that occur. All right, does my screen look good, Rosemary? Okay, so here's your relationship support and community connections. So you're going to identify, what happened with things. And you're going to document the specifics in the progress notes section of the note. So here's an example. This is Nancy going to a reunion for the first time in Clinton for the first time in 3 years. She had a family visit. She had a family event. She participated independently or with a family and friend, and she had assistance provided by staff. So she was in a good mood when I arrived because she's going to her family reunion in Clinton. She's going with her sister, Sarah. I drove her to Sarah's house and we stopped at Walmart to pick up cookies. For the reunion, they got to Sarah's house around noon. Sarah will provide supports for the rest of the day. I clocked out when I left Sarah's house. So that's a good description of that relationship support activity. This is a poor example. Family event is all that's checked. Staff dropped Nancy off at sister's house around noon for family reunion. So it just doesn't give any depth. So that's what we're talking about. Give a little more detail about the activities that occur. Remember, these things are not going to happen every single day. So when they do happen, though, we want good information. Doesn't have to be a book, but enough to describe the activity. Education, work, and social roles. The types of things that would go in here is someone going to school. Are they taking GED classes? Are they taking any type of schooling for future employment? Work activities. Did you take them to look for a job? Did they go on an interview? Did they attend a job fair? These are activities that could be addressed in your education, work, and social roles. And your social role activities, I'll be honest with you, you can put it here or you could put it in the community event section. Do they belong to an organization and did they attend a meeting for that organization or an event for that organization? So did they belong to the church choir? Did they go to choir practice? Do they belong to the DD council? Did they go to a meeting? Those are the types of things that would go in this section. And again, you're going to identify what type of assistance was provided, how'd they get to and from the location? Did they need assistance? What kind of support was provided to participate? Did they participate with the assistance of another provider? Sometimes you're there and someone else is helping them. Did they participate independently or with a family or friend? As a reminder, they're only required to document what happened while they're on shift. This is their note for their activities when they were with the person. The specifics, again, go in that bottom portion of the progress note. And if they're using the multiple shift note for single date of service, so if they have those 3 shifts, so if they're using that note with 3 shifts, then we kind of want you to initial these activities here instead of just marking an X, because you're going to have more than one person providing support that day. So here's one. They provided assistance getting to and from location and assistance in applying for an opportunity. This is, and I used this in the other example. I drove John to NTCC to enroll in GED classes, helped him fill out the application. It's going to go Tuesdays and Thursdays from 3 to 5. Has a goal to get his GED. Again, that's a good note. A poor note is I took John to apply for GED classes. You can give a little more depth for the note. So that's when we talk about content. This is an element. You know, the education work social role, that's an element. The content is the depth of the content. We want a little more information in the content to show what occurred. Health and medical appointments, same thing. Type of appointment. Were there any notes from the doctor? Any follow-up needed? And if you're using the multiple shift for single date of service, you use initials. So if you're using a multi-shift note, use initials up here. But if you're not, it's a single shift note, you just mark the X. Here's one. Janie had doctor appointment today. This is the same type of stuff. She had a doctor put on vitamins with 25 milligrams of iron once a day, picked up vitamins at Walgreens. Janie has a follow-up appointment. Doctor visit summaries in the binder. Contacted supervisor to update medication lists. Now, this was done for a provider agency. In this case, they may say contacted employer to update medication lists because, or supervisor. The employer is the supervisor. So really that wouldn't be any different. So this is a good example of appointments. This is a poor example. Had an appointment with her PCP today and he put her on vitamins. She goes back in a few months. They had more detail. So we want the detail to be provided. You know, if you don't know when the follow-up appointment is, you can't put it in the notes. We understand that. If she has to be rechecked in 6 weeks, maybe that's what you put to make sure you make the appointment. But if you know the date and time of the next appointment or the date of the next appointment, you put it in the notes. We don't expect you we want the detail that you have to go into the notes. Challenges. Now, I didn't have a very good example of a challenge in the handwritten note, so I do want y'all to kind of pay attention to this. Here are the types of challenges. Did they have medical symptoms? Was there a critical incident? Was there a behavioral incident? Was there a medication error or a problem? Was there a plan followed and documented? Was a supervisor or professional contacted for assistance? Now, this is what we require the providers to do. Employers typically are families, so they're going to be aware of these things, but we still need the challenge to be documented. Document the specifics on the progress notes. So here, this person had medical symptoms. They had a medication error problem, and they contacted the supervisor for professional assistance or professional for assistance. Now, here's an example of someone missed their medication in the morning. They didn't feel well after lunch. Said his chest hurt. And he felt like he was going to throw up. During lunch, he threw food at me because he didn't want to eat. I notified the provider nurse who came and did an assessment. And the nurse contacted the doctor to get instructions on adjusting meds for the rest of the day. In self-direction, you're going to be contacting the employer, the supervisor of the DSW, who is the employer, who is you. So they would contact, instead, they wouldn't notify the provider nurse, they would notify the employer. And the employer may not have done an assessment. The employer may have contacted the doctor to figure out what to do for the rest of the day. Here's a poor example. Dan felt bad today. He had a behavior problem because he felt bad. He did not eat much today. That doesn't give a good picture. You want something that's going to give a little bit better picture because this is the information you actually knew. ADLs and IADLs. So what here is what kind of support did you provide for ADLs or IADLs? If it was independent or someone else assisted, provide the name and the role and the level of assistance of that person. And if you look at it, it's not that difficult. So hang on just a second. If it didn't occur while the person was on shift, just write NA. If additional details are required, you can put that in the progress notes section, but there is a way to put that in the ADL section. For the multiple shifts note, that's a little different. You have to write all of the details in the progress notes section. But this is what the ADLs looks like. And here I have filled it out for Nancy. And this goes back to the person that we were, that was going to the family reunion. So she fixed her own breakfast. I helped guide selection of clothes for family reunion. She independently washed her face, brushed her teeth and hair. And you know, if that's a goal, if she did it without prompting, and you normally have to have prompting for that, then you could put that in the progress notes section. She had a goal to complete grooming independently. She did that today. Toileting, she may not require any assistance with that. So she completed that independently. There's no bathing or showering, no mobility, lifting, or positioning. But remember, when we looked at the note for Sarah, they did some shopping. So for they picked up cookies on the way to Sarah's house. Sarah independently cleaned the kitchen after breakfast. They reviewed the checkbook with Nancy for shopping later. They prompted her to stay on schedule to go to her brother's house. And they prompted her to take her morning meds. They didn't administer, they prompted. So those are the types of things you can put here on your ADLs. They're all listed. Those are easy things to document for those ADLs. This is a poor example. There's a lot of blanks and there's not a lot of information about it. Did she do anything independently? Did she provide assistance? Was there any prompting? So this is not a good example. And other things occurred that just aren't documented. That's why if something didn't happen, it's good to put NA here because it didn't occur on the shift. So you don't expect any information to be in that blank. The last section is the progress notes, description, and comments. And when you're using a notebook and you're writing everything out, at the end, you should sort of give a brief description of the day because you've already got a lot of stuff written in the notebook for each section. But if you don't, all of that detail is going to be in the progress note. And in addition to that, what else happened with that person that day? So here's some good examples. Drove Leonard to 2 apartment complexes to put in application for housing and talks about what they did to put in that application, where they went to put in an application for housing. Or down here at the bottom, here's someone that works an overnight shift. I checked on John every hour throughout the night. He got up once to go to the bathroom. He slept good tonight. Or if they stayed in all day and didn't do a whole lot, we'd still need to identify if anything happened in those other sections. But John stayed in today, watched Law and Order and Chicago PD most of the day. He had cereal for breakfast, a sandwich for lunch, and pizza for dinner. We did laundry since we stayed in. The day was quiet. So occasionally that may happen. Or you may have an individual whose day looks the same day after day after day. It's okay. We want you to reflect what actually happened. So if it looks the same, that's fine, but just give a little bit of depth to what the day looked like. What we don't want is I drove Leonard to put in application and I assisted with completing the application. Well, there's more information than that. Or John had a good day, or John had a good night. There's got to be a little more depth to the information that y'all provide or that your DSW provides in that section. And we have an additional page for notes. All right. Is there anything specifically that I need to address?
There's some concerns with the form.
Okay.
Apparently, when it prints out, it's not printing out the entire section, like the type of notes or the written notes, it's not printing out.
Okay.
And then they want to know, does it expand? So does your form expand?
All right.
Can they have their DSW use the computer and type up their notes before they leave home, et cetera, et cetera? So it's things around the form.
Okay, and so we'll answer the things around the form. The forms, yeah, if it's fillable, you can type the information in. The worker has to sign it. So you can't just, because we don't know who's typing the form, so the worker has to sign it. So you print it out. If it prints out on multiple pages, that's fine. Just have the worker sign the form up at the top, where they have their signature box. But go ahead and send those questions in and we will address.
So I have another one here. They say that notes that are entered in the BCI system and don't disappear. The notes report can be generated, but they won't really go away. This note section in BCI is not meant to use progress notes and it's not recommended.
Okay. So,
Just clarify.
yeah, we will provide the additional information that Acumen provided for DCI. But as they said, the notes section in DCI was not intended for progress notes, and it's really not what it should be used for. But we will provide that information in the Q&A. So,
Can you reiterate the date that this is going to begin?
yes,
And how many years of documentation?
Yes.
In each county, and that this is going forward, that they do not have to retroactive to do this move.
okay. So number one, this goes into effect May 1st. So we want all the elements. We want all of the elements on your notes starting May 1st. We know you may need a little time to get this in place. Today's March 12th. So May 1st, we want all the elements that we've talked about to be in your notes. You have to retain documentation for 6 years. CMS has the right to request that documentation, as does the state, for 6 years. Even if someone leaves the program, they can come back and ask for it. So for 6 years, you need to retain that documentation. And we never recommend that you try to recreate notes that were not prepared on the day that the activities occurred, because I don't know that the notes were truly reflect the activities of the day. That's why notes have to be prepared at the end of every shift, because that's when an individual knows what was done that day, and it documents the activities. If we request documentation and you don't have it, then we'll have to address it. But I never tell someone to go back and create a note based on memory. And so I think that answers those 3 basic questions.
So the person that's talking about this, but it does not print beyond.
Okay, we'll take a look at it. We'll take a look at it. All right, we will take a look at the notes and make sure that they fill properly. Remember, there's a fillable note and a non-fillable note. Make sure you're using the fillable note. They're 2 different types. And if you are using the fillable note, we'll take a look at it. So we're going to go ahead and wrap up with the training we will address your questions. But just remember, what we're trying to do is to give you an idea of what content should be in your documentation and the fact that the documentation is required. So we want good documentation. We want documentation that supports the time that has been billed and paid by CMS and LDH, Louisiana Department of Health, so that there are no questions that these services are needed and they are being delivered. That's what this documentation does. We're not asking you to write a note every 2 hours, every 30 minutes, nothing like that. But we need a good description of the shift, of the day, what happened. Something had to happen during the day, even if it's that they sat there and they watched something, if they binge watched something, whatever. Something happened that day. And there are other activities I'm sure that happened that day. So we need to capture those. Is, like I said, it's to support the money that's paid for the service, basically. So just to wrap up, documentation of services is a CMS requirement. Documentation of services is also a program requirement or state requirement. No documentation means no services were delivered. That's a biggie. You have to have documentation to support the services that were provided. Undocumented services are at risk of recoupment by state and federal agencies, and that has happened. So we have to have documentation of services. OCDD will monitor all employers to make sure that they are in compliance. We don't have a schedule for that, but all employers will be monitored to make sure that they are requiring notes to be written that meet the elements of this training. And do your best. Train your staff to do their best to provide a good picture of the activities that occurred, and especially address those areas of relationships, community outings, medical appointments, work, education, challenges, ADLs, IADLs. Be sure to address those areas because those are the things typically they are doing and any progress that they're making towards goals. Employers that are not in compliance with documentation requirements will be at risk of losing access to self-direction because we have to require the documentation. And if employers won't do that, then the only thing we can do is say, okay, well, you can go to a provider agency, but we can't allow you to continue in self-direction if you're not going to be in compliance with documentation. And it's just, there's a benefit to self-direction, but there's a consequence if the requirements aren't followed, I guess. I don't like to talk about that stuff. So again, training was provided today. I know this is a lot of information. This is going to be posted on YouTube. So you'll be able to access it. You have to begin using the standard note format that contains all of the elements of the standard notes by 5125. It cannot be used, DCI cannot be used for electronic notes. Notes must be retained by the employer and be available if requested 6 years. The training video, which is the YouTube that's being recorded today, and the PowerPoint will be available at this link. So go ahead and write that link down. I'm going to leave it up for a few minutes. But I need a couple of days before we can post the links, or we can post the link to the YouTube and get the PowerPoint posted. I recommend that you just go back through and go back through the video and look at the documentation. Remember, the documentation is supposed to guide you into the areas that need to be documented. And the documentation needs to be descriptive of what happened. That's what we're asking for. And we have to have a note for every shift. So those are the things that are important. I'm going to leave this up, and Christy, that concludes my training, unless y'all see anything else I need to provide.
No, I thank you so much, Kim. Thank you for working through that. Again, as a reminder, I see that there are people that have their hand raised. We're asking that you put your questions into our Q&A box. We're going to print all those questions out, consolidate and get an FAQ out in order to respond to the questions that you all have. We really appreciate you all joining us this afternoon to look at this information and review this with us. And we will look to get everything posted and get your questions answered and sent out to you as quickly as possible. Thank you again.
Here's the email, ocdd-hcbs@la.gov. Sorry for scrolling back through real quick.